There it goes. Jose, you got me?
Oh yeah, yeah. I can't start the video though.
You should be able to now. Go ahead.
All right, cool. Yo,
How
I
goes it?
hate these freaking these large legislations. They drive me nuts because there's so much crap in there that's
I
just
know.
in there to fill in and sneak crap through. It's wild.
I was looking into it a little bit, and there's definitely a lot. Um, I don't know if we'll be able to cover it all in this particular webinar, but
Well, I mean,
it's
and this whole part two crap. I mean, just looking at it. Well, I mean, I know we're gonna dive into it today, but it's just it's a mess for no other reason than they wanted to create a safe harbor and test some
mhm,
stuff, I think. But and by they I mean Congress and the lobbyists because they don't know any better.
of course. So we got Dana in here. Galen, welcome to the
Nice.
webinar. Appreciate you guys being on today. Dana, it's been a while. Hope you're doing well. If you could throw a chat or a emoji in there, just want to make sure that's working today. Don't be shy. Chat is working. Thanks, Dana. Appreciate it. Hope you're doing well. I'm gonna go ahead and share this since we got a couple people in here. Let's
Yeah, let's go and get started.
well now well
There's a lot to get
oh
there's
shoot,
a
it's
lot to
already
get through, and I'm
1:35.
sure it's gonna cause some
Good night.
conversation.
All right, we'll go ahead and get it running. I wanted to I did you see the clips the other day?
Which clips?
The
Oh
eclipse.
no, the eclipse?
Yeah,
No, I
the
didn't see the
the
eclipse last
eclipse.
yesterday. The
Well,
eclipse.
it
No,
was
no, no.
it was nothing here in Jacksonville, Florida.
Well, that's
And
what
it
I heard. It wasn't even going to be that big of a thing here.
no, it
Other
wasn't.
parts of the U.S. were getting it better, I guess.
Here, I'll share this real quick just before we get started. We'll give just another minute. Let me know if you can see.
That's
I
not worth me trying to go blind for.
so
It's
which one do you think is in Jacksonville?
the one on the right.
Yeah, that was the peak of the eclipse here in Jacksonville. Although it looks cool, but it's not, you can't really see the actual eclipse going on. So,
No, no.
the image on the left, I have a friend that just moved to Austin, Texas, which apparently was like a
Okay.
center point for this, and he sent that.
Yeah.
And he also took a selfie. I didn't want to post it here, but it was pretty dark out there.
Well, yeah, it gets
figure
pretty
I
dark.
figure I'd share that that difference. I mean, we didn't see nothing.
Yeah.
It was disappointing,
Well,
but
hopefully people that wanted to see more of it got to see more of it and the rest of us got
right.
to work.
It wasn't that.
So
I mean, it wasn't that big of a deal. I
yeah.
just, we were just curious what we would see, and there's a hell
Yeah.
of a difference. But
Yeah. Yeah.
anyways, we'll go ahead and start with today's trivia. Again, those are just joining in. We do this every week. We do it just a quick trivia, get the brain juices flowing before we jump into the today's subject matter. But question today, and this is from our webinar. I think Jose we did 2 weeks ago, right?
Yes.
Regarding
Yes.
the Change Healthcare ransomware attack and how that's affected quite a bit. Which I think we're going to be doing another webinar here down the road to sort of
Yeah,
give an
probably
update
in
on
a
that.
couple of weeks when they get
Yes.
fully back online, we should
Yeah.
do another one.
Yep. Yep. But anyways, questions referring to that topic. But what group claimed the responsibility for the cyber attack on Change Healthcare in February of 2024? And the answers are A, I'm just going to say Alpha V, or known as Black Cat, B, Beta V, known as Beta Cat, C, Beta Tech, or D, Dark Web. You guys go ahead, throw your answers out there. I guess this is going to be a tough question if you weren't on that webinar, but you can always take a guess.
Multiple choice.
Multiple choice. You got a 25% chance.
Yeah.
Come on, Dana, put something in there. Oh, Okay, we got a A from Nicole. All right. Dana says C. Gail Ann, feel free to chime in. You got 10 seconds. All right. Gail Ann says D. So we got different answers here. I like this.
A little
So
bit of
again,
everything.
yeah, a little bit of everything. So again, the question was what group claimed responsibility for the cyber attack on Change Healthcare as reported in February of 2024? The answer is actually A, Alf V, or known as Black Cat. And again, for those of you that might, that might have missed the webinar and wanted to get caught up, there was a cyber attack that occurred on Change Healthcare, which is a group owned by United Health. It led to, what was it, Jose? A week-long shutdown of its systems. More than
No,
that,
it was weeks long. It was
weeks long.
weeks long shutdown.
Which
Yeah, they just got billing back up and running a week and a half ago.
just nuts. But that's what it impacted greatly, was the impacting providers billing, eligibility checks, prescription processing, all the above. It was not a good thing, and they're
Yeah,
still sort of dealing with the adverse effects
fallout.
of that. So like I said, we'll be doing another webinar sort of touching base on that and see where things are going. And essentially what that comes down to is who's to blame. Right.
Yep.
um, but
People are
anyways,
already asking questions about why this happened and how it happened and all that fun stuff. So
yep,
I
it's
imagine that when the incentives for the for auditors and healthcare come out for next year, which should probably be here soon, they're going to be asking about contingency plans. So hint, hint, if you don't have one, figure it out for all your critical systems. So,
have to have a plan B. A plan
yep,
C and
yep,
D
yep,
does
yep.
not hurt as well. So that's
Yes.
why these contingency plans come into play. But appreciate you guys participating in that. We'll go ahead and get started on today's topic. Again, my name is Ray Walters. We'll be your host for today, and I work with Epi Compliance, and am joined by my co-host, Mr. Jose Delgado, a seasoned expert in the healthcare and consulting realm. Currently owns a mental telehealth clinic, and Jose
Yep.
works very closely with us, in particular at our in-person Epi conferences event as an instructor. And I think there's a couple people in here that might have been to the in-person event, but one of the again, our in-person conferences is sort of revolves around healthcare innovation and compliance. And one of the interesting certifications that we teach at this in-person event is a certified HIPAA security officer training. And it's really a course that we recommend to anybody in healthcare, essentially business owners, compliance officers, health administration. Um, and it really it gives you a deeper perspective into HIPAA and everything that applies to the same. And Jose is an instructor for that as well. Jose, do you want to add anything too?
Yeah, it's an 8-hour boot camp that we try not to make boring.
Yeah.
So it's
The long story
because
short.
it's dry material. So we try to really make it interactive, so we'll talk about current cases going on that have issues that have to do with certain areas of the boot camp and that we're addressing, whether it's from the administrative side or the physical side or the technical side, which the Change Healthcare cyber attack is definitely going to be highlighted on our next technical through the next technical side of things, especially as more
Absolutely.
information starts coming out, more congressional subpoenas and court cases and all that fun stuff pop up. So that'll be
And
fun.
just to add to that, this is a course that, again, we've currently been offering at our in-person events, but we will be offering here very soon in an online format. I mentioned this in last week's webinar, but I think the target right now is going to be end of April. Um, so stay tuned for that. We will be sending out some more correspondence regarding the same. And like I said, it's a great certification to have. Separates, I'd say it's a good resume booster. if anything, other than gives you a very broader perspective on the on HIPAA and what that entails. But anyways, we'll go ahead and dive into today's topic, which is going to be navigating the CARES Act, uh, specifically provisions
Recent
for
news.
healthcare. So, without further
So
ado,
yeah, there's a CARES is definitely going to be something rather involved, but it's involved and not because of the way that they worded part two. And it's so the too long don't read of this is if you are in a healthcare practice that addresses substance use with your patients, so if you're a primary care and you have some patients that used to be in a program and are still on some kind of medication or treatment plan, and you fall under the part two statutes and protections. Um, so you're looking at, this could be something as simple as, hey, I had an old depressive patient and now they got addicted and they went through the program and I've kept them. But if we talk about it, if it's in the record and you take federal or state money from this, you fall under those patients fall under the part two protections.
mm,
So we want to make sure that everybody's kind of understanding. When I'm reading the tea leaves on this, it looks like the federal government is testing this as a way to later on expand. There's good and bad with all of this stuff, So um on the good side of it, it allows for a protection, it allows for a convenience for the patients in respect of, hey, once I've signed a release, I don't have to keep re-signing the release when it regards to investigative agencies, federal agencies, um, anything with that respect. Once I'm giving the whatever organization the right for my record to be disclosed to them, I don't have to redo it for whatever reason. It's done. One of the other things that it also allows as well is, which I found to be very interesting, because I'm trying to find a scenario where this would happen and I would want to know this, is a disclosure that I get to know, or I get to have a record of all the people that my record was disclosed to, which doesn't make much sense to me because in order for you to have my record, I would have to sign off on it, or a
right.
court would have to sign off on it. And if a court signed off on it, I would know about it because I would be, as a patient, I would be in trouble in some way, shape, or form. So it's a very interesting piece here. I'm very curious to see what's going on there. It is supposed to restrict the use of records and testimony in legislative proceedings, but it creates a safe harbor for investigative agencies if they accidentally get some information. So
Yeah.
it's really really weird, right? So when we look at it, let's go through a use case of this, right? I'm an opioid addict. I mean, hell, I could be George Floyd for all it matters with all the stuff he had in his system. I go through a program. I'm going to go to court, but I don't give the police access to my record. They get a court order from my primary care. My primary care happens to have some kind of information in regards to my substance use past. The police, instead of my lawyer being able to go and say, no, no, that information is fruit from the forbidden tree, you cannot use it, you cannot bring it into court. Now the police can retroactively, once they've gotten the information, go to a judge and say, hey, I want a court order for all of this stuff. And then that way it can all be put in and they get a complete record of all my substance use disorder and all of my issues that come into play. So it's one of those, like, it creates more powers for the patient, but it protects government agencies when they do something they're not supposed
Uh,
to do.
well, Jose, the example that you're giving, I'm like thinking here out loud. Your substance abuse. Are you a law abiding citizen?
Well,
maybe
so
there's reason for cause for. Well, I'm just you see where I'm going with this.
but yeah, no, 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 absolutely. And but it brings up the point though, right? If
Yeah,
I'm looking at if I am a suspected criminal, because remember, I'm a suspect
right,
until I'm proven guilty in a court of law.
exactly,
Your job is to prove that I've done something wrong. My job is not to make it easy for you,
true.
right? So in that scenario, I don't want to give you any information that would help you,
And
whether I am the
obviously, the
person that
attorney
did the case, did
wouldn't
the.
want that either. So no, makes sense.
Oh no, no, absolutely. Like I would. I mean, I don't care what it is. They could be looking. They could be. They could be looking me up for a DUI. I don't
Sure.
want them to know that I'm in a substance use disorder program.
Yeah. No.
You know what I mean? Because then what happens there? Now all of a sudden the penalties are even worse because I would have known better because I'm in a substance use program. And
Right.
probably if I got a DUI and it was a substance use disorder and I got substance use disorder on there, I shouldn't be having alcohol anyways because I'm in a program.
Yep. Yep.
You know what I mean? So I don't want the federal government or state government or whoever is investigating me to have that kind of information. No,
Yeah.
hell no. I don't want them
No, it's
having
interesting.
any information on me.
So they essentially
Yeah, so
they can sort of supersede, and
and they can sort of supersede HIPAA without
yeah.
superseding HIPAA. Now,
Yeah.
the good news is that this is only all of these caveats and legislative. I cannot wait for the court cases that come out of this one. All of the safe harbors and disclosure rules, all of this only applies to Part two patients. And in the CARES Act, what it means is Part two is any program. And you know what? I'm going to read it straight from the
Y-
legislation,
I was
just so
gonna
that way
say if
I'm
you
getting.
if you
I've got it
could
right here. I've got it right here.
send a link
So
in chat for everybody.
yeah, I'll send you the. Yeah, I'll put the final rule link in here. So it's the Part two statute protects records of the identity, diagnosis, prognosis, or treatment of any patient which are maintained in connection with the performance of any program or activity relating to substance use disorder education, prevention, training, treatment, rehab, or research, which is conducted, regulated, or directly or indirectly assisted by any department or agency of the US. So what does that mean? That means that not everybody, this doesn't apply to everybody. This applies to
Right.
patients that are Medicare, Medicaid, what's that tribal insurance? I need you to be quiet, buddy. The tribal insurance. If I'm working with a governmental agency in regards to their employees,
Mm.
so if I'm working with local or state police or firefighters, or you know what I mean, like this is very, very. It's force. It's
Interesting.
the longest run-on sentence ever. My middle school English teacher would be killing me if I ever wrote this down on a paper for school. You know what I mean?
Uh,
Like, let me put this in here in the chat real quick. But yeah, so it's
so
very, very
so it obviously
long.
has a an impact on HIPAA. You know.
Absolutely. I mean, it all in one go, it supersedes and expands HIPAA for this segment of the population, which is interesting because this is a kind of patient that if you're on a substance use disorder diagnosis and you're in a program or on a program or in an insurance, because of the nature of the beast, you're more than likely on some kind of federal or state aid because you've already wrecked your life.
Right.
You know, this is the Suboxone patients, this is the methadone patients, this is the hydrocodone, addicts that ended up, I got a bad knee surgery and then they started down this huge destruction of their life, whether they meant to or not, is completely indifferent. But those patients usually end up on Medicare, Medicaid, VA. I, I got nothing. You know what I mean? Like it's one
Right.
of those like it's gonna be very very interesting. And of course, as with anything that's new, because all of this stuff just got into effect. Because this final rule is from
I was gonna say,
2020.
when did part
Okay,
two?
so no, this
Oops.
is this is February 8th, 2024. So this
Okay,
is for this year.
gotcha.
So
The
this
part
is
two was
hilarious.
very recent.
Yeah, yeah. So this is hilarious because this is in effect now, but CARES Act was passed in March 27th of 2020. So it took them 4 years to come up with a way to come up with a final rule. This, you know? So it's very new. If you're in a subsection of healthcare that doesn't have to do with these kinds of patients, thank your lucky stars. Be ready though, because it's very rare that the federal government does something for one section of the population and doesn't expand it out, you know? So I would not be surprised if in the next 2 years, the next Democratic president or the next Democratic Congress pushes something to expand this to all patients.
Ah, that right there will be nuts.
Well, I mean, and it took them 3.5 years for the final rule to be released because they were having problems getting the CARES Act to align with HIPAA and with high tech.
Right.
And it
Which
says it right here in the final rule that I put in the chat. So it's one of those things where even the federal government isn't sure on how it's going to do this, but it's basically just creating. It's just be aware of the subpoenas. Dina, what's up?
do you have a question? I might have missed it.
No, she raised her hand. So, oops. All right. Well, I can live with oops. No worries. You were just testing to make sure that it works. I got you, Dina. I
And
got you. We're paying attention.
and I
But yeah, so I
appreciate
mean,
it.
yeah, so I mean, I always like to be ahead of the curve when it comes to compliance because then I can afford to be a little sloppy in my initial rollout because nobody knows, right? But if I assume that these rules are in place, the most stringent rules, then I can really adjust, right? So when it comes to that kind of scenario, right now I would recommend that everyone increase the thought process on what they're releasing when it comes to a subpoena, if that makes any sense.
No, it
So
does.
then, huh?
No, it does.
So assume that everything is super confidential if it even remotely looks like it, and then go from there. Only if you ever get a subpoena from a lawyer or from a court, give them only exactly what you're looking for, and if what they're looking for, and that you are required to give. And if you have any doubt, redact.
Redact. I like that word.
Because what I expect to see happen is that there's going to be patients that will end up that are part of this part two piece that will sue the provider, even though the provider is following the part two rule.
So, Jose, how, as far as telehealth goes, because obviously you have experience in the
Yeah. Yeah,
in
yeah, yeah.
telehealth, how does this apply on the HIPAA security side of
So
things?
for telehealth, what it means is that I need to make sure that I'm not using the same one easy example is not using the same, for example, video conferencing chat
Mhm.
and call for multiple patients. So if everybody has to have a unique video conference call room, for lack of a better term. I want to make sure that the patients understand their responsibility or lack thereof can create a an unhealthy scenario for them. So where are these calls being done? Where are my providers taking these calls from?
Not the coffee shop down the road.
Not they should
Hopefully.
not be doing it at Starbucks. They should not be doing it. Honestly, they should not even probably be doing it in their office. This may be something that you go and say, "Hey, I'm going to go out to my car for my smoke break. Take your visit out there because you can do it on your phone
Right.
rather than doing it in the office." Because you may have information that you're talking to your provider about on a telehealth call, but even if you have an enclosed office, someone may hear it. Those
Still
walls
doesn't matter.
in a corporate location are relatively thin, you know.
Right.
Um, it's usually drywall and a random beam for support, you know. Like, it's not very, and some wiring. It's not very complex or soundproofed. So it's something to where, you know, everybody's got to be aware of what's going on. If on the provider side in our offices, it's fine in our office because the only people in our office should be patients and employees. So you'll be fine. So is the note that a person is off Suboxone enough to cause a problem? Yes. And that's my biggest issue, right? So for me, it would be something that Dina, I could go and say, hey, my patient, even in this telehealth scenario, right? I can there are some video conferencing tools that will allow you to record every single visit, just like we're doing right now with the Zoom. So what ends up happening is I go and record the visit, we go over your medical list, and then I get a subpoena as the provider for the note, or for, hey, they find out that I have a video call and we're discussing, hey, how's the Suboxone affecting your sleep schedule? You know, hey, are you drinking while you're on Suboxone? You better not be. You know, I mean, in some states, you better not be, you know, better not be even taking some marijuana gummies to help you fall asleep. You're not on pain meds, right? You know, so like us going over that kind of medication list can be an issue, which would then either cause for us to not submit it or we go and redact it, which makes it more of a pain for us, Dina, honestly, because then we got to print it, black it out, and then send it. Some EHRs are starting to get a little hip to the idea of limiting what is sent out and or offering to opt in what is sent out and what is not from straight from the EHR. So I know Practice Fusion, because that's the one we use in our office, is able to go and check. I can checkbox everything that I want to send to wherever and download to my computer. So if I want to send just the notes, just the medication list, the diagnoses and the medication list. You know, I can send everything, even the messages, the intra-office messages, which as a rule, I never, ever put those in the subpoena because the intra-office notes are never, or they're not intended for the actual record. They're always like, hey, patient called about this, patient called about that. That's not actually part of the record, so I never include it. So now I can exclude it with a click of a button rather than going through and be like, all right, not this, and manually doing it. So, so yeah, so
As far as your
cool.
I was going to say, Jose, the obviously when you're meeting a patient over to telehealth, are you using a app through the Practice Fusion to do that, or is it
So
separate?
Practice Fusion has a couple of different video conferencing tools that they use. A lot of the EHRs now have either white labeled or created their own video conferencing tool that connects directly to the scheduler, which makes the uptake a lot easier. So it wasn't an issue for us when they expanded the telehealth opportunities. And again, if you're in the mental health or substance use, CARES Act also expanded, you know, Suboxone visits, but that's a whole nother bag of tricks. Where if you're looking to do that, you can see a new Suboxone patient and just write the script with a quick telehealth call and move on as long as you see them. in the office within the first 30 days. But
Hmm.
that was actually part of a DEA final rule that just coincided with the way the CARES Act was expanding everything for that patient population, for Suboxone and for methadone. But I would say like we use UpDocs currently, but that's UpDocs and it's through Practice Fusion. Different EHRs have different ones. We use Zoom as a backup because Zoom can be secure. The
Sure.
main thing is most things are HIPAA secure as before any human actually touches it. Once the human touches it, that's where it
It's the
always gets messy and
human
dirty.
element gets involved.
Yeah, the human element is always what screws up the compliance piece. So what we want to do is we want to make sure that we're aware and we have backups, so when UpDocs and Practice Fusion are down, we use Zoom momentarily and we move on, with our day. We continue so that way we can keep treating our patients. Because our patients, our specifically practice is mental health. So our patients can go through withdrawal issues if we don't address things quickly in a timely manner, so. Um, so yeah, so CARES expands and contracts the patient's rights and the providers are sandwiched in between as usual. Um, so we want to make sure
Like
that we've
everything.
got very clear understanding of what we can and cannot do. Um, I would very much begin to, if I do not give out releases unless I have something signed, obviously, but even in car accident scenarios or slip and fall scenarios where the patient says, "Oh, just give it to my lawyer." I'm like, "No, I want to talk to the lawyer. I want to know exactly what they want because I'm not going to give them anything other than exactly what they asked for. And if they forgot, they forgot. That's on them. I'm not here to get sued because I gave you too much information. Because everything you give to one side, it's going to go to the other side as well in the evidentiary part,
Right.
in the disclosure part. So anything you give to a court, both sides are going to have.
What other
So we got,
what other key
huh?
considerations would you consider providers to do regarding the CARES Act?
So regarding CARES Act, I can see it getting messy if anything with family law, it's gonna get messy. So, I could be a perfectly good parent and have a substance use disorder that's been handled for a while, but it can get brought up and all of a sudden
That
I don't have visitation with my kids, or I have supervised visitation. Like I can see a lot of issues with that. Um, I can see where the idea was to make things easier for these patients. The funny part is that Congress created Part 2, but HIPAA in and of itself already protected these patients with the super confidentiality.
right.
So it didn't make sense to create this, or at least I'm not seeing the purpose behind it on top of everything else because they created this part 2, but then they went ahead and said, okay, well, all the criminal and civil penalties for a breach still occur here. Oh, and by the way, this and high tech still applies. And by the way, what else was it? Oh, but by the way, we have a safe harbor for our investigative agencies. So if we're looking for something and you help us find it, or you and give us something that we accidentally needed to help make our case stronger, then we're going to go ahead and use it and find more information on it. So you end up screwing your patient without even knowing it, without even taking them out to dinner first. So it's just, it's wild, like I mean, if you have a complaint, you send it right back to, it's the same methodology. The patient consents. So it prohibits combining patient consent for the use and disclosure of records for civil, criminal, administrative, or legislative proceedings with patient consent for any other use or disclosure. Requires a separate patient consent for use and disclosure for substance use counseling, and requires that each disclosure made with patient consent include a copy of the consent or a clear explanation of the scope. Now, this is just for the part 2 stuff. It doesn't
Right.
technically have anything to do with the telehealth side. And it technically doesn't have anything to do with the COVID side, which is why they even pass this friggin' thing to begin with. So whenever we're looking at one of these omnibus massive pieces of legislation, there's going to be this, it's layers to an onion. We're going to be seeing stuff just get peeled and peeled and peeled. And the best way to keep an eye on it, honestly, is be part of the ship. You know, all of these final rules, they have a period of time before they're implemented where they take in comments and questions and get involved with the process. Like I know it's a pain in the butt, but I want to have a hand on that steering wheel as much as possible because if not, I'm just going to get run over.
I wonder what the comments
You know,
were up until this current.
I would love to see all the
I would
comments.
love to
Oh
see
my
that too.
god.
I can't imagine if it would be a good thing. Oh yeah, this is great. Like this is helpful.
Well,
It just
keep in mind that the people that are always commenting are the agencies that have to enforce these things,
right.
the lobbyists. So every lobbying group that is involved with it is going to be saying something about it.
Something, yeah.
So I'm sure the AHA, the AMA, hell, the APTA, you know, like even all the specialists for mental health and psychiatry boards, I'm sure they all had their input or their comments that they made, but they need to hear from us on in the trenches.
I don't know. There's the article that you sent over there. I don't know if this is pertaining to the legislation or this article in general, but there's a comments link there that I'm trying to click on. You see it?
No,
It's
no, I don't see
it's
it.
just above the you see where it highlights major changes in the new here. I'll actually just switch it over here to screen.
Yeah.
It says public comments. Modifications in its
Yes.
final rule reflect the proposals
Yeah, yeah,
published in
yeah.
December
Yeah.
2022. Is this the what we were talking about or
Yeah. This is what we're talking about.
browse all
See,
220
so
comments?
the fact that there's only 220
That's crazy.
comments is wild.
Just well, just shows that
I
not a lot
mean,
are
and
informed.
if it's all and you see like a lot of them are from see, so we got a few
Universities, big health,
smaller clinics and stuff. Bamboo
AHA,
Health, I guarantee you that's a substance abuse agency.
Athena.
Athena, that's an EHR. There's a lobbying
Here
group,
we
the
go.
Alcohol
Drug Policy
Rehabilitation.
Alliance,
AHIMA is a lobbying group. There was a couple
Public
hospitals
of
in there,
Health,
LA County. You know,
Society
so
of
when
Addiction
you look
Medicine.
at these, yeah, I mean, so I mean, I would definitely say that more smaller offices need to be involved. Like, so we have a couple in here sprinkled in, but there need to be more.
Sure.
We need to act as though this is going to affect us because if not, they're just going to do whatever they want, you know?
Which
So if you don't know when these final rules and when these comment periods occur, right now, April through June is a lot of times when the commentary period occurs because everything comes into play after the fiscal new year for the federal government, which is in September 15th, either August or September 15th, one of the two.
mm,
Um, and then everything kicks into play for the following year because then in November, December, they release the final rule to tell you, hey, January is coming through and this is what it is. So one of those things that every year happens is the for most healthcare practices, when do you look up what the new Medicare deductible is going to be? Usually in October, November. So you know what's going on for January, or you can prep your patients. Hey, the deductible's going up. Hey, the deductible's going down. So that way they know what's going on. Well, okay, guess what? 6 months before that they released that, there was a commentary period.
right.
So
So in other words,
it's
this is the time.
yeah, this is the time. So if there's a specific thing that you're concerned about with that's in Congress right now or just got passed, then you want to jump in and start taking a look at it. One of the best ways to do that is with being on the monthly newsletters for the agencies that really affect your subspecialty. So for me being in mental health very primarily right now, DEA is a huge one for me. So CMS, DEA, I'm on their monthly newsletters. So I know when to comment and when to really start bothering my congressman in regards to certain things. So we have to be active in this process because
Absolutely.
this stuff is ridiculous. At this point, what it would be is if you have patients that are substance use, I would ask all of them if they want to continue paying with insurance or find the money in cash. If you're in the substance use disorder field, if you're not in the substance use disorder field, but you have substance use patients, you just got to understand that they are substance use patients, and if their payer is Medicare, Medicaid, VA, CHIP. I mean, you see some wild stuff. So what we want to do is we want to make sure that that they're flagged, those records are flagged. So if there ever is a subpoena, that you only give out what is absolutely demanded of you. CYA,
Good
baby.
points. Good points. No, I appreciate the insights, Jose. And before we do conclude today's session, I want to remind everybody about the resources that we offer here through Epi Compliance and Epi courses. We do provide free OSHA training and again, this subject today has nothing to do with OSHA, but for those that don't know, according to OSHA.gov, new employees, new hires have to take the OSHA training within the first 10 days of hire. We offer a free solution for that at epicourses.com. If you're looking for something more robust, we do offer HIPAA training bundles. We do have a program that does essentially the one all be all, offers training, policies, procedures, business associate agreements, as well as a tasking solution as well. That's our Epi Compliance Pro package. But above all, if you guys have any questions, concerns, or looking to hear more about compliance side of things, don't hesitate to reach out to Jose or myself. We do offer free consultations for that. And as far as today's subject, I want to open up for just a quick Q&A. If you guys have any questions, concerns regarding today's session, please feel free to chime in and chat. Jose and myself will do the best to answer.
And while people are typing, what are we doing next week?
Next week, we're going to be talking about the SAFER guidelines and a little bit about
the evolution of macro and MIPS.
macro and myths. We're back to it. It's not going
Well, I
anywhere, so
mean, this
might as well
is
keep it going.
well, I mean, you just got done reporting, and now you're like, crap. I didn't have to give a crap about safer guides, and now I do.
Now you do.
Now
So
I do.
we're going to be sort of diving into that next week. Jose, I'd imagine we could probably do several webinars on that subject alone, but we're going to sort of
Well, we'll just go over the TLDR because it's complex, but it's very complex for facilities. For smaller offices, it's like a two-page section or a two-question section. But realistically, those two questions, if anybody's familiar with filling out governmental paperwork, those two questions or pages end up being 15, 20. So, but they are the easier ones. So we'll go over it. And I'll have
no,
some stuff that
definitely.
we can show.
Jennifer, I appreciate you being here and look forward to seeing you next week. Hope to see you next week. And you have a good rest of your day. Anybody else have any questions, concerns? Don't be shy.
I'm gonna have to
If you guys,
call. I'm
if
gonna
you
have to
guys
call a
have any,
lawyer friend of mine
yeah,
because I'm curious to see if the change healthcare piece, being unable to send information the way that it's supposed to for the macro MIPS measures, if it affects my numbers for this year because of the safer guidelines and everything. Huh.
let me know.
That's gonna be
That'll
a
be
fun one.
that could be
That's
something
gonna be a fun
that could be
one.
something that we can chat about next week.
Yeah. That I'm sure that an answer to that will come down the road, but yeah, I'm very curious to see. Huh. This thing gets worse and worse the more we look at it. Cool.
Does, man. Well, I don't see anything coming in, Jose. So I guess it's safe to
No
say that
worries.
no questions or concerns today. So,
I look at it like we covered it succinctly and perfectly then.
well, just to let everybody know, we did record this. We will be posting these on our YouTube channel. Uh, for those of you that are interested in watching any previous videos that we've done, we've been doing these webinars since September of last year. Please go give us a follow on YouTube, or a subscribe, I should say. You just type in Epi Compliance and you can find us there. Um, Other than that, Jose, again, I appreciate your time, and
Yep.
be seeing you next week. And again, if
Yep.
anybody
See you
has any
next week.
questions, concerns, please feel free to reach out. No stupid questions, a stupid question here. Thanks, Jose.
Have a good one, guys.
Take care, everyone. Bye.